Hello, hi everybody. Am I audible and visible, guys? Hello, hi everybody. Am I audible and visible? Okay, chalo. So welcome back, everyone. And today we are on our next episode of Short Session, guys. PSM. So like I've said earlier, also this is completely an MCQ based session where we are revising all the topics with the help of MCQs. 45 minutes to 1 hour session. So let me just repeat it. We are done with EPID. We are done with screening. We are done with concept of health. We are done with vaccines. Today we have demography and family planning. Okay. Tomorrow you will have nutrition. So every day the sessions are happening at 2 p.m. and Telegram quiz is happening at 8 p.m. Okay. Also please remember 8th of December is a very big day because on 8th of December we will be practicing and revising all the PYQs. Okay. We will be revising all the PYQs. So without wasting too much of time here, let us continue and you can put in your doubts and queries towards the end, guys. Okay. Alright. So the first question out. Arrange the following stages of demographic cycle in correct order. Arrange the following stages of demographic cycle in correct order. What is your answer here? Arrange the following cycle in of stages of demographic cycle in correct order. Let's see if you can do it. Instead of asking you directly, they can ask you, okay, let's see if you can arrange it. So we all know, okay, most of you are writing option B. We all know the first one is high stationary. Okay, the first stage is high stationary. Let's revise it. What happens in high stationary stage, everybody? High stationary में क्या होता है? You all know demographic cycle, or basically we can call it actually demography transition model. Okay, demography transition model is governed by two things, CBR and CDR. So in high stationary, CBR is also high, CDR is also high. So both are high. So population is stable, right? Population is stable. I'm just revising demography transition model once. Okay, population is stable. Then what happens, guys? When a country goes to another stage, we are first concerned about increasing the life expectancy or saving the lives of the people. So what is going to decrease first? CDR starts to decline. Okay, CDR starts to decline. But what happens to the birth rate? Nobody is worried about family planning right now. Okay, so birth rate is still high. Okay, highest birth rate आपको first stage में मिलता है. Second stage it is still the same. In the first stage if it was 30, second stage में भी वो 30 है. ठीक है? Alright, so still high. Alright, it's still high. So what is happening to the population? It is expanding, and the problem is the population is growing at faster rate. Okay, population grows at which rate, guys? At a faster rate. Okay, population grows at faster rate. Now what happens in the third stage? So you can look at the gap is CBR minus CDR. ये भी बढ़ते जा रहा है. ठीक है? Then what happens in the third stage? Deaths further lowered. And for the first time, we are worried about family planning. We are worried about birth rate. So birth starts to decline. Okay. So what happens in the third stage? Death rate continues to decline. Okay. Death rate continues to decline. And for the first time, everybody, births starts to decline. So anybody can ask you, which is that stage where births रेट सबसे पहले डिक्लाइन करता है? वो कौन सा स्टेज है जहाँ पे बर्थ रेट सबसे पहले डिक्लाइन करता है? दैट इज third stage, which is what? Late expanding. Okay, population is growing, but at which rate? At slower rate. Okay, at slower rate. Then ultimately what happens? This demographic gap come hota hai in the fourth stage. Deaths are also low, births are also low. Okay, birth rate low, death rate is also low. First stage क्या था? Births high, deaths high, population stable, high stationary. अब क्या है? Birth low, deaths low. So what is this, everybody? This is low stationary. Low stationary मतलब again the population is stable. Okay, and what happens ultimately? डेथ ना लाइफ एक्सपेक्टेंसी एक लिमिट तक इंक्रीज हो सकती. ओके, सो अल्टीमेटली व्हाट हैपन्स, बट फैमिली प्लानिंग कुड बी वेरी गुड इन एनी कंट्री, लाइक इट्स गुड इन डेवलप्ड कंट्री. सो फाइनली व्हाट हैपन्स, द बर्थ्स आर बिलो द डेथ्स. Okay, CBR is below CDR. So what is that, everybody? Declining phase. Okay, declining phase. Clear everyone? ठीक है. All right, declining phase. Try to understand this. Okay, you should try to understand the concept here, because they could ask you any stage. Like if I ask you, which is that stage where birth starts to decline and the death rate are already declining? बताओ कौन सा stage है जहाँ पे birth starts to decline and the death rates are already declining? So where does the birth starts to decline? Late expanding, and deaths are already declining. What is that stage? Stage 3. Okay, so you should know all these things. Try to get the concept right over here. So first it is high stationary, early expanding, late expanding, low stationary. Clear? So that was the first question. Now which stage is not desirable by any country? Please remember, this is not desirable. Early expanding बिल्कुल desirable नहीं है, क्योंकि in this the country is stuck. Okay, फंस गया है. उसको क्या बोलते हैं? डेमोग्राफी ट्रैप. डेमोग्राफी ट्रैप मतलब पॉपुलेशन एक्सप्लोड हो रहा है, पॉपुलेशन एक्सप्लोजन. Population is growing at a faster rate, which is a very problematic thing. Okay, not the first stage, the second stage. Second stage is not at all desirable. And which is the stage which is desirable, guys? Low stationary. Okay, this stage is desirable. Low stationary. Clear? Everyone? Okay. Chalo, let's go to question number 2 for the day. So just based on the model, I've given you some questions. See, in a European country, continuous deaths are happening, but no new births is reported. The country is in which phase? Can you tell me? We'll discuss Mronali, maximum and minimum gap. एक MCQ के through ही discuss करेंगे. Okay? These sessions, all topics will be discussed via MCQ. So we'll go to that MCQ. Okay. European country is a very big buzzword. Okay, this means it is stage 5, and over here no new births is reported. Okay, but the deaths are happening. So what is it? CBR is below CDR. So what is this phase, everybody? This phase is the declining phase. Okay, CBR is below CDR. Okay, let's go to the next MCQ for the day. Just excuse me 1 second, I'll be back. 1 second. Okay, ठीक है. So where do you see the highest birth rate, everybody? Very good. The highest birth rate is always seen in stage 1. बिल्कुल मत बोलना stage 2. The highest birth rate is always seen in which stage, everybody? It is seen in stage 1. Okay, all right. Another question for the day. Let's see this one. Yeah. Identify the correct statement with reference to demography transition model. Now, demography transition model is important. It's a very important topic. It's a very important PYT. Okay, it's a very important PYT that you must revise for all these exams. So, मैंने बोला identify the correct statement. बताओ, demographic gap is maximum in early stage 2. Demographic gap is minimum in stage 5. Demographic gap starts contracting early stage 3. Demographic gap is negative in stage 4. So what is it, guys? First of all, what is demographic gap? Demographic gap runs the entire demography transition model. ठीक है, demographic gap क्या होता है, guys? Crude birth rate minus CDR. Okay, CBR minus CDR. So now I'm going to go to one of the most important images. Let's revise this. अब इसमें मैं आपको बताती हूँ how the questions have been asked in FMGE exams, NEET PG as well as INICT. It is one of the favorite PYQs, one of the favorite PYTs. Okay, now see. When the exam में FMG exam में question आया था, they asked the name of this image. What is the name of this image, everybody? Demography transition model. We shouldn't say actually cycle or population cycle or growth cycle. No, it is showing transitions from one phase to other. So what is the name of this? This is nothing but a demography transition model. Now look at this. In NEET PG, it has been asked in the latest NEET PG exam, guys. They asked कि label लेबल करो. सो द पर्पल लाइन ओवर हियर इज CBR and the green line over here is CDR. Okay. Now what happens in stage 1? Okay, stage 1. Stage 1 में births are high, deaths are high. Birth rate also let's say 30, death rate also let's say is 30. So what is happening to demographic gap? Demographic gap is minimum. Where is demographic gap minimum? Stage 1 and stage 4. यहाँ पे भी. Okay, CBR, CDR. All right, both are in stage 1 दोनों हाई है सेम लेवल पे, तो CBR माइनस CDR मिनिमम है, और दोनों स्टेज 4 में दोनों लो है, सो इट इज मिनिमम. वेयर इज द डेमोग्राफिक गैप मैक्सिमम एवरीबडी? वेयर इज इट मैक्सिमम? नाउ व्हेन डज birth rate, death rate starts to decline in stage 2. So घटना शुरू होता है. birth rate अभी भी high है, birth rate is still high, the one it was at stage 1. So this gap is increasing, but where will it be maximum? In the over here early part or late part? It will be here. So maximum in late stage 2. Okay, maximum कहाँ है? late stage 2 में. ठीक है, all right. Then what happens in stage 3? Stage 3 में deaths continue to decline, घटते जाएगा घटते जाएगा. births for the first time starts to decline. So can you see this gap is going to reduce? Okay, and where is it going to be less, guys? Where is it going to be, where does it start contracting? So demographic gap starts contracting here. It starts contracting. कहाँ पे start करता है contract होना, guys? It starts contracting in early stage 3. Okay, and where is the demographic gap? Negative. Where is it negative? In stage 5, when CBR is below CDR. Okay, so it is in stage 5. Okay, where is it negative? Stage 5. Got it? So देखो, FMGE exam में they ask the name of the image. NEET PG में they've asked the labeling. INI-CT में they've asked the interpretation of demographic gap, and the good thing is we have done all of the 3. Clear? Give me a thumbs up. So let's go to the question again. Let's see over here. Demographic gap is maximum in early stage 2? No, it is maximum in late stage 2. Demographic gap is minimum in stage 5? No, it is minimum in stage 2 and it is minimum in stage 1 and stage 4. Okay, demographic gap starts contracting. Yes, it is negative in stage 5. Clear? Negative in stage 5. ठीक है, all right. चलो, let's go to the next one. Mrinali, let me do one thing. Let me wrap up the MCQs. I will take up the model once again. Don't worry dear. ठीक है, खत्म होता है फिर. डर लगना स्वाभाविक है. डर लगता है अर्जुन, अच्छी बात है, डर लग रहा है, बट बहुत ज़्यादा डर लगना आपका टाइम वेस्ट कराएगा. सो बिल्कुल बहुत ज़्यादा डर के पीछे अपना टाइम वेस्ट नहीं करना है. डर के आगे जीत है, बोलते हैं ना. प्रोसेस को एंजॉय करो, ठीक है. ज़्यादा सोचेंगे तो टाइम वेस्ट होगा, और हमारे पास अभी टाइम कम है. ठीक है, तो खुश रहो. डर के आगे जीत है, एग्ज़ाम निकालना है, और वही हमारी कोशिश होनी चाहिए. ठीक है, क्या होगा तो किसी को नहीं पता, कब क्या होता है nobody knows, but right now process is in our hands. Okay, so let's work on it. Okay, चलो, गुड. यू आर फीलिंग अ लिटिल अफ्रेड. थोड़ा बहुत डर लगना ही चाहिए, तभी तो उठ के सुबह पढ़ोगे, रात में सोने से पहले पढ़ोगे, नहीं तो टाइम पास ही करते रहेंगे. ठीक है, चलो आ जाओ, आगे बढ़ते हैं. ठीक है. विच स्टेज ऑफ डेमोग्राफी साइकिल हैज सेम बर्थ रेट बट वेरिएबल डेथ रेट? एनीबडी? विच स्टेज? थिंक एंड मार्क. डेमोग्राफीज ट्रांजिशन मॉडल का सेम बर्थ रेट है बट वेरिएबल डेथ रेट. कैन यू टेल मी विच स्टेज? Same birth rate, okay, but variable death rate. So which one are you going to mark? Very good guys. Okay, same birth rate. Okay, all right, but the variables death rate. Stage 1 में birth rate and death rate are the same. Stage 2 में birth rate is still the same but death rate has changed. So it is what? Stage 1 and stage 2. That's how they will trick you. Did you understand this question? बहुत सारे बच्चों ने लिख दिया है स्टेज 2 एंड स्टेज 3. बच्चे स्टेज 3 में बर्थ रेट सेम नहीं रहता, बर्थ रेट स्टार्ट्स टू डिक्लाइन. बट आई हैव आस्क्ड यू कौन सा स्टेज है जहाँ सेम बर्थ रेट है बट वेरिएबल डेथ रेट. सो वी ऑल नो दैट बर्थ रेट इज द सेम, ऑलराइट, इन स्टेज, ओके, स्टेज 1 में जो बर्थ रेट है दैट्स इन स्टेज 2 ऑल्सो, एंड डेथ रेट इज वेरिएबल इन स्टेज 2 ऑल्सो. ओके, so that's how they can trick you instead of asking you directly. Chalo, let's see if you can do this one. What is the population doubling time for a country with an annual growth rate of 3.5%? Anybody in the class? Population doubling time for a country with annual growth rate of 3.5%. इसको कैसे करते हैं? Just wanted to revise that. You know there is a Malthusian model. I have discussed this in prep ladders, RR sessions also. Okay, Malthusian model which tells us about the population doubling time. Okay, this is based on rule of 70, which means the population doubling time, everybody, for any country, okay, population doubling time for any country will be 70 divided by annual growth rate. So here it is 70. What is the annual growth rate, guys? 3.5. okay, so how much will this come to? If you see over here, if it was 2%, okay, we would have done it. If it was like 3%, okay, so when is it going to increase? What is your answer over here? Very good, very good. ये कब बढ़ जाएगा? 20 years में. ठीक है, population of this country will double in how many years? 20 years. If they gave you population double, annual growth rate किसी country का, AGR किसी country का 1% है, ठीक है, so population doubling time 70 by 1, which is 70 years. okay, currently India is loitering around 0.9 to 1% AGR. okay, so we are kind of in no longer in a rapid growth phase, but we are like in a moderate growth phase for India. okay, also one more thing, guys, India abhi किस stage में है? I hope you remember, India right now is in the late expanding phase only. Why? Because birth rate declines slower than death rate. okay, birth rate is declined slower than death rate, या बोल सकते हो death rate is declining faster than birth rate. clear? everybody, population doubling time कर लोगे, इंडिया का around 0.9 to 1 है. okay, let's see if you can do this one. Take your time. Take your time, guys, and let's see if you can figure out. This is a very important question of the day where I've asked you to calculate dependency ratio. In a family, Mr. Ram is 69 years old and his wife Sunita is 56 years old. They have a 28-year-old son, his wife 26-year-old, and they have a granddaughter, okay, and they a 5-year-old. Calculate the dependency ratio for the family. Calculate the dependency ratio for the family. Now, guys, I hope all of you remember who are the dependents. What is the dependency ratio, guys? It is nothing but children below 14 years, okay, children below 14 years, okay, plus elderly beyond 65 years, okay. They are dependent on the working class or economically productive class, which is 15 to 64 years. ठीक है, ये कौन सा class है? ये है working class, okay, या economically productive class. अब children below 14 years, this forms what? Children below 14 years क्या होता है? Young age dependency, okay, young age dependency. And elderly above 65 years is what? Old age dependency. Now see over here, Ram is 69 years old. So Mr. Ram, let's count the total dependent. Mr. Ram is a dependent, okay, all right. Wife Sunita is 56 years old. So Sunita is working class, okay, she comes under 15 to 64 years, so she is the working class. 28-year-old son, 28 year, ये भी working class है. Wife 26 year old, so 26 year wife उसकी है, ये भी working class है. Okay, granddaughter 5 years, so granddaughter again 5 years is dependent. Yes, so what are the number of total dependents in the family? Total dependents is how many? Total dependents, everybody, is 2. And working class कितना है? Working class हमारा कितना है? Working class is 3, right? Working class is how many? 3. So what is dependency ratio? 2/3. Since I've asked you ratio, all right, what can you do it? 0.66. If they asked you in percentage, you would have multiplied into 100. Got it? All you need to figure out कि कितने dependents है. Dependents कैसे figure out करोगे? बच्चे below 14 years, elderly beyond 65 years. And आपको साथ में क्या figure करना है? Working class. Working class कौन होता है? Between 15 to 64 years. Thumbs up everybody if you got this dependency ratio का question correct. Then I'm going to move to the next question. Quickly बताओ, got it correct everybody? Okay? Yeah, only till 3 p.m. Let's see this one. What is the growth rate of a country if CBR is 19 and CDR is 7? Alright, what is the growth rate of a country if CBR is 19 and CDR is 7? I told you in these sessions we will be doing numericals because ab numericals aate hain and we are not going to leave any numerical undone. Okay, we'll try to cover maximum questions, okay, so that you have that confidence for your exam. चलो बताओ, मैंने क्या पूछा आपसे? ग्रोथ रेट. ठीक है, सो ग्रोथ रेट ऑफ अ कंट्री का फॉर्मूला इज CBR minus CDR upon 10. Okay, annual growth rate of a country is CBR minus CDR upon 10. So 19 minus 7 by 2. Okay. Sorry, minus 17 लिख दिया ना मैंने, 7. Yeah, 19 minus 7. So how much is it? Yes, very good. So this will come to around 1.2%. Okay. 12 upon 10, okay, so 1.2%. Now ideally we don't have the nearest value, okay, so which one? 1.2 exactly तो है नहीं, तो 1.1, okay, 1.2%. just remember this, CBR minus CDR divided by 10. Okay, moving to the next question. Social mobility is movement at socio-economic levels. This belongs to demographic bonus, demographic burden, demographic process, demographic dividend. Let's quickly revise a few terms over here. Social mobility, demographic bonus है, demographic burden है, demographic process है, demographic dividend है. So social mobility everybody is what? Demographic process. What is demographic process? See, you know that the country population बढ़ रहा है, घट रहा है, तो क्या क्या फैक्टर्स उसको गवर्न करती हैं? दैट इज डेमोग्राफिक प्रोसेस. सो यू कैन रिमेंबर इट लाइक दिस, अ कपल गेट्स मैरिड, मैरिज के बाद क्या होता है? बच्चे होते हैं, सो फर्टिलिटी. Okay, fertility. Now the couple has bacha, so now they think that, you know, or birth rate, okay, now they think that they should migrate to another country. यहाँ पे पैसा, they are not earning a lot, so what do? They migrate. Now if you migrate, you might earn more, you might earn less also. So if you are earning more, you can become higher class from lower class. If you earn less, you can become middle class, say lower class. So what is that? Social mobility. Okay, social mobility. And what is the last one that governs the population size? Of course, mortality. Okay, so these are our demographic processes: marriage, fertility, migration, mobility, as well as mortality. Clear? All these remaining terms also I am going to discuss with the help of an MCQ. I told you everything MCQ. Chalo. Increase in dependency ratio because of increased old age dependency is known as, what is the answer to this? Increase in dependency ratio क्योंकि ओल्ड एज डिपेंडेंसी बढ़ रहा है, उसको क्या बोलते हैं? डेमोग्राफी विंडो, डेमोग्राफी बोनस, डेमोग्राफिक बर्डन, none of the above. Now guys, you remember I had made you learn in the classes also, in RR also, in LRR also we had discussed this. There are two terms guys, एक होता है डेमोग्राफिक बोनस, ओके, और एक होता है डेमोग्राफी बर्डन. ओके, डेमोग्राफी बर्डन. ओके, नाउ व्हाट इज द मीनिंग ऑफ बोनस? बोनस मीन्स some advantage. So what is the advantage I'm going to get over here? Decline in dependency ratio. Okay, burden means कोई भार है. So what is the burden? Some pressure. It is what? Increase in dependency ratio. Now why is there a decline in dependency ratio? Because of, due to decline in what? Young age dependency. Okay, young age dependency. Young age dependency क्यों घट रहा है? It is due to decline in young age dependency. Why is young age dependency declining everybody? क्यों घट रहा है? Because there is now low fertility. Why is there low fertility? Due to improved family planning. ठीक है, improved family planning. Okay. Now burden. You've seen Hindi movies, old people को burden बना देते हैं English movies में भी, but it's just to remember, we should not do that ideally. ठीक है, इसीलिए यहाँ पे dependency ratio बढ़ क्यों रहा है? Because of increase in old age dependency. Okay, due to increase in what? Old age dependency. And why is old age dependency increasing? Because of more life expectancy. People are living longer. So if I say increase in dependency ratio because of increase old age को movies से याद रखना burden है, so that is demographic burden. Okay, now what is window? Demographic window is, guys, when जब फैमिली प्लानिंग अच्छी होती है, बर्थ रेट कम होता है, सो द प्रेशर ऑन इकोनॉमिकली प्रोडक्टिव एज ग्रुप इज लेस. सो व्हाट इज डेमोग्राफिक विंडो? व्हेन वर्किंग क्लास इज प्रोमिनेंट. ओके, व्हेन वर्किंग क्लास इज प्रोमिनेंट, गाइज, दैट इज व्हाट इज डेमोग्राफिक विंडो. ऑलराइट, वर्किंग क्लास. ठीक है, McCarran, did you understand? See what happens, because फर्टिलिटी रेट्स कम हो रहे हैं, फैमिली प्लानिंग इज वेरी गुड नाउ. ओके, सो जो वर्किंग क्लास है, द प्रेशर ऑन देम काइंड ऑफ हैज रिड्यूस्ड. ओके, सो व्हाट हैपेंस, द इकोनॉमिकली प्रोडक्टिव एज ग्रुप और द वर्किंग क्लास इज प्रोमिनेंट. दे आर पीपिंग थ्रू अ विंडो, एंड व्हेन द वर्किंग क्लास इज प्रोमिनेंट, दे विल लीड टू इंक्रीज इकोनॉमिक ग्रोथ. इकोनॉमिक ग्रोथ को क्या बोलोगे ड्यू टू वर्किंग क्लास? Demography dividend. Okay, that is known as demography dividend. Got it? Increase economic growth due to working class is what? Demography dividend. Clear? Everybody with the term, everyone understood. Bonus क्या है? डिपेंडेंसी रेशियो घट रहा है बिकॉज ऑफ डिक्लाइन इन यंग एज डिपेंडेंसी. व्हाट इज बर्डन? डिपेंडेंसी रेशियो बढ़ रहा है बिकॉज ऑफ इंक्रीज इन ओल्ड एज डिपेंडेंसी. बिकॉज ऑफ यंग एज डिपेंडेंसी डिक्लाइनिंग, वर्किंग क्लास इज पीपिंग थ्रू अ विंडो. दैट इज demographic window. Working class is prominent, contributing to more economic growth. That is demography dividend. Thumbs up. Everybody give me a thumbs up if you've got it correct, if you've understood. Okay, I'll make a small video of this topic also, demographic dividend window bonus, and I will put it out, okay, on YouTube only or Insta also, only in the form of like 1-minute video. Okay, so that you can revise it later. Chalo, what is general fertility rate? Now this is a must do PYT, guys. Again, previous year topic. General fertility rate क्या होता है? Very good. Everybody knows that number of live births in a woman in reproductive age group 15 to 44 years. Okay. Now guys, just a quick revision. बहुत सारे fertility rates है. Yes, there are a lot of fertility rates. Okay. The first one is CBR. What is it? Total number of live births per 1000 mid-year population. Now mid-year population, CBR is the simplest measure of fertility. Okay, it is the simplest measure of fertility. Now guys, CBR, mid-year population में you can have children also, you can have elderly also. क्या सारे बच्चों को जन्म दे सकते हैं? Can everybody, is everybody exposed to giving birth to a baby? No. So we made it little specific. General fertility rate. Total number of live births per 1000 women who can give birth, women in reproductive age group, that is 15 to 49 years. Now women in reproductive age group में भी, is it that a 18-year-old unmarried girl and a 25-year-old married woman, who is more exposed to giving birth? Obviously the one who is married. Yes, obviously the one who is married. So what it is? General marital fertility rate. Total number of live births per 1000 married women. Okay, married women in reproductive age group 15 to 49. Clear? Did you understand the three definitions, everybody? Okay, all right. Okay, did you understand? Okay, all right, so that you should remember. Now look over here, unmarried woman may we are not looking at. What is option C? Can anyone tell me? Number of children a woman will have if she were to pass through her reproductive years. ये क्या है? Number of children. Children is the buzzword of total fertility rate. Okay, children is the buzzword. All right, total fertility rate. नो रवि, 15 to 44, बहुत लोग 15 to 44 मानते हैं, बट नाउ वी कंसिडर reproductive age group as 15 to 49 years. If it's 44, it doesn't make a difference. Okay, but now that was an MCQ. It will be written as 15 to 49 or 44. That doesn't make a difference. Okay, Ravi? Chalo, very good. Children is TFR. Let me give you some other question. Chalo. Which fertility indicator is influenced by variations in age-specific mortality rates? Tell me. Age-specific mortality rates. Age-specific mortality rate. Which fertility indicator is influenced by variations in age-specific mortality rate? गलत नहीं होना चाहिए ये, बहुत ही important question है. Okay, what I'm trying to ask you over here, mortality dependent fertility indicator. Okay, what is this? Mortality dependent fertility indicator. So what is the mortality dependent fertility indicator, guys? Net reproductive rate. It is the most sensitive indicator of achievement of family planning services. Most sensitive indicator of achievement, all right, of achievement of family planning services. Okay, that's the most sensitive indicator. TFR क्या है? Buzzword for TFR, total children from 15 to 49 years. Right from 15 to 49 years एक couple का या woman का कितना बच्चा होगा? Children. It could be boys, it could be girls. So TFR is an indicator of what? Again a PYQ, complete family size. Now out of those children, okay, how many are girls? If you have the buzzword girls, it is gross reproduction rate. And how many girls are going to stay alive? That means mortality dependent fertility indicator is net reproduction rate. And I'm sure all of you remember that for a country's population to stabilize, for a country population to stabilize, किसी भी country के population को stabilize होने के लिए TFR should be 2.1, which means the country is relying on a 2-child norm. This will be achieved when net reproduction rate is 1. That means out of the 2 children, 1 is obviously a girl. ओके, लॉ ऑफ प्रोबेबिलिटी, अगर किसी के 2 बच्चे होते हैं तो एक बच्ची उसमें लड़की है एंड एक बच्चा बॉय है. लॉ ऑफ प्रोबेबिलिटी. ओके, and when will net reproduction rate of 1 be achieved, guys? When couple protection rate or contraceptive prevalence rate is more than 60%. Okay, India में currently the TFR has been achieved as 2.0 and contraceptive prevalence rate is 66.7%. Clear? Okay, all right. Now let's go to some contraceptive related questions. All of the following are non-contraceptive benefits of OCP except. OCP except. Can anyone tell me? All of the following are non-contraceptive benefits of OCP except. What is the answer to this? 20 minutes by the clock now. Okay, we'll revise contraceptives. What is the answer to this? Okay, what is it? Very good. All are non-contraceptive benefits of OCP except. Very good. Obviously OCP RTI STI से नहीं प्रोटेक्ट करता. अब देखो INI-CT में आया था, ठीक है, कोई बहुत डिफिकल्ट है नहीं. So whatever we are preparing now, the same things come in PG INI-CT. It's just that we have to grab in a few extra concepts, advanced things for INI-CT. पर basic तो फिर भी आते हैं. Low chance of ectopic pregnancy, yes. Ectopic pregnancy is a contraindication for IUD, relative contraindication, not OCP. Ovarian cancer, endometrial cancer, it protects from. Cancer जिसका risk बढ़ाता है, cervical and breast cancer. Okay, so that is the answer over here. All right, so you will see in the PDF I have mentioned the non-contraceptive benefits also. Protecting from benign breast disorders, fibrocystic disease, fibroadenoma, but it's increasing the risk of breast cancers. Okay, all right, but research अभी चल रहा है, मतलब they are doing some research where it might not be increasing, but as of now 2 cancers जिसका risk बढ़ता है, cervical and breast. आयरन डेफिशिएंसी अनीमिया, ओवेरियन सिस्ट, वी ऑल नो 7 आयरन टैबलेट्स होते हैं ओसीपी में, ऑस्टियोपोरोसिस, पीआईडी, पीआईडी में आईयूडी इज नॉट गिवन, ओके, इक्टोपिक प्रेगनेंसी यू कैन गिव ओसीपी, ओवेरियन एंडोमेट्रियल कैंसर, डीयूबी एंड डिस्मेनोरिया also. Let's see another one. See, which of the following is not a contraceptive benefit of OCP? Can you tell me? Is not a contraceptive benefit of OCP. Treats ovarian cyst, okay, protects against ovarian cancers, prevents osteoporosis. यस डॉक्टर पुनीत, ओके, तो क्या है इसमें, वेरी गुड, माइग्रेन अब भी पढ़ा ना, यहाँ पे देखो OCP is protecting from ovarian cyst. I just made it into another question, but prevents migraine? No, migraine is a relative contraindication for OCP. OCP से migraine का chance होता है, ठीक है, all right. चलो let's go to the next one quickly. Which type of cancer won't be affected if a patient uses OCP? Which type of cancer won't be affected if a patient uses OCP? Endometrial cancer, cervical cancer, breast cancer, bladder cancer. So different types of questions I'm asking you. Which type of cancer won't be affected if a patient uses OCP, guys? Obvious. Why are you writing bladder cancer? Endometrial और ovarian cancer के लिए तो protective है ना, endometrial and ovarian cancer, it is protective, right? So why are you answering over here? I asked you which type of cancer won't be affected if somebody has endometrial, it's not affecting it. So out of the 4 options, why not go with endometrial? Okay, all right, let's go to the next question. OCP can be advised safely to a woman in which of the following conditions? बताओ, OCP एक वुमन को एडवाइस करोगे इन विच ऑफ द फॉलोइंग कंडीशंस? विल यू गिव हर इन ब्रेस्ट कैंसर? विल यू गिव हर इन कंजेनाइटल हाइपरलिपिडीमिया? विल यू गिव हर इन लिवर डिजीजेस? No, Puneet, it's not saying which is not affected. Not affected and risk decreases. Okay, if somebody already has endometrial and ovarian cancer, it's not like it's going to increase it. Okay, so it's not getting affected because you're eating OCPs. Okay, all right, what is the answer over here? PID. OCP can be advised safely in PID. In PID, IUDs are contraindicated, not OCPs. ठीक है, but breast cancer, congenital hyperlipidemia, liver disease, of course OCPs are contraindicated. See, this you should know. Absolute contraindication of OCP, pneumonic, CULT, cancers, breast and genital cancer, मतलब which cancer? Cervical. C से cardiac abnormalities, anyone has a heart defect, congenital hyperlipidemia, U से undiagnosed uterine bleeding, liver disease, thromboembolism, past or present history, ठीक है, you will never ever advise OCP. इसीलिए guys, any woman who is 40-year-old and wants a pill, you don't give her OCP. Risk of cardiac abnormalities might be there. If she is 40-year-old and she wants a contraceptive pill, please put her on progesterone only pill, because heart problems किसकी वजह से होता है? Heart problems is because of estrogen content of OCP. Okay, it is because of estrogen content of OCP, not on progesterone. So if a 40-year-old comes to you and she tells us कि मुझे contraceptive pill ही डालो, तब क्या डालोगे? Progesterone only pill. Okay, never put her on this one. These are all the relative contraindications. We've discussed this in RRs and LRRs also. Age over 40 years, smoking over 35 years, mild hypertension, renal disease. Renal disease is relative. Okay. Liver disease, absolute. Epilepsy, migraine, can you see? Nursing mothers first 6 months कभी नहीं देना है because OCP interferes with this one, your lactation. Okay, all right. In non-breastfeeding women, you can still start OCP after 21 days. But in a breastfeeding woman, आपको कभी भी OCP नहीं देना है, this one. Yeah, all right. Okay, Mirena and all, we put it in red bags. Okay, if it's unused, you can put it in yellow. Otherwise, you will put it in red bag. All right, look at this one, guys. This is just for the just to revise. ठीक है, माला एंड माला डी, एन मतलब दिस इज अवेलेबल फ्री, एन मतलब नो कॉस्ट, सो फ्री ऑफ कॉस्ट मिलता है. दिस इज इन्वर्टेड ट्राइंगल इज द फैमिली प्लानिंग का लोगो दैट वी विल डिस्कस इन इमेज सेशन. डी मतलब वी आर प्रोवाइडिंग इट अंडर सम दिस थिंग, इट्स नॉट प्रोवाइडेड free. All right, so this you have to know. Okay, they might ask you what is the content of estrogen, progesterone. So progesterone, levonorgestrel, synthetic progesterone है 0.15 mg, ethinyl estradiol 0.03 mg. ठीक है. And you know जो oral contraceptive pills markets में मिलते हैं ना, private like in pharmacy shop, if you go and buy, they have even lower estrogen 0.02 mg. ठीक है. And 7 iron tablets है, the iron tablets are of ferrous fumarate. Okay, let's see another one quickly. Contraceptive option available to a 28-year-old breastfeeding mother with a 6-week-old baby wishing to avoid next pregnancy are all of the following except. Just wanted to discuss one point कि कौन सा क्वेश्चन कौन सा कॉन्ट्रासेप्टिव ब्रेस्ट फीडिंग पीरियड के लिए मोस्ट सूटेबल है. ठीक है, बताओ. Can you direct your question towards the end, guys? We missed the question, so session खत्म होने दो, फिर जो नहीं डिस्कस हुआ you can ask me later. Very good. OCP is never given within the first 6 months of lactation. Okay. Now, ideally, first 6 weeks after delivery, we tell the couple not to have sexual intercourse, abstain from it. But if any couple wants to have, what is the contraception of choice? Contraception of choice within first 6 weeks of delivery. If somebody asks you, okay, within 6 weeks also, within 6 weeks of delivery, अगर कोई बोल रहा है कि मुझे दो कोई contraception, it is progesterone only pill. Okay, not IUD, because I want to discuss. Okay, this is Implanon. You can give IUD 380A. Now IUD 380A or levonorgestrel IUDs, now they should be inserted up to 48 hours. Okay, up to 48 hours or after 6 weeks of delivery. ठीक है, 6 weeks of delivery. Now she already has 6 weeks, तो क्रॉस हो चुका है ना. बट पहले IUD we were saying that you know it can be inserted within after 48 hours also, within 1 week also, postpartum IUCD. But now we say that it should be inserted either you know within 48 hours या after 6 weeks of delivery. ठीक है, got it. So progesterone only pill. So tell me the answer to this. Best contraception option available to a 28-year-old breastfeeding mother with 4-week-old baby. क्या मार्क करोगे? 4-week-old baby क्या मार्क करोगे? अंतरा, IUD 380A, progesterone only pill और OCP. Yes, progesterone only pill. Now guys, what is Antara? I hope you know it is nothing but injectable DMPA. Okay, in which injection of DMPA has to be given 150 milligram intramuscular every 3 months. Okay, the only problem, it is now available by the brand name Antara as a newer contraceptive. Okay, this is available as a newer contraceptive. Okay, freely as a newer contraceptive freely till subcenter level. Okay, all right. Okay, so I have put in the PDF one slide, you can go through it later. See, IUCDs within 48 hours of delivery with C-section or after 6 weeks of delivery. ठीक है, अंतरा भी तुम 6 weeks after delivery लगा सकते हो. ठीक है, but look at this, progesterone only pill, very important, that's our choice. Okay, but if a 48-year-old woman comes to you और बोल रही है कि मुझे लगा दो contraceptive pill दे दो, तो progesterone only pill. Okay, another newer contraceptive which is available guys, weekly oral pill छाया. ठीक है, ब्रेस्ट फीडिंग, नॉन ब्रेस्ट फीडिंग, एनी टाइम आफ्टर डिलीवरी. सो आफ्टर प्रोजेस्ट्रॉन ओनली पिल वी कैन गो फॉर छाया. ठीक है, छाया क्या है? इट इज़ नथिंग बट नॉन स्टेरॉइडल hormonal contraceptive. Okay, hormonal contraceptive, and this is available, this was earlier available by the brand name Saheli. Okay, Centchromin. Okay, Centchromin. अब इसको किस नाम से जाना जाता है? छाया, weekly only pill. Okay, so they are both newer contraceptive, Antara as well as Chaya. They are freely available till the level of subcenter. Got it? Clear everybody? और मेलॉक्सिफिन इसमें होता है. क्या होता है? और मेलॉक्सिफिन. ओके, और मेलॉक्सिफिन. Chalo. Going to the next question, some IUDs. Absolute contraindication for the device in the image. Anybody? Yeah, absolute contraindication. Any doubts, just keep it towards the end, guys. Okay, absolute contraindication for this one. Very good. Vaginal bleeding. Past history of PID is relative. Uterine malformation, relative. Previous ectopic pregnancy अब relative contraindication है, not absolute contraindication. And this is which one, guys? Copper T 380A. Okay, this you have to know. Completely T-shaped and this one. What are the absolute contraindication? Pregnancy. ठीक है, suspected pregnancy. Okay, suspected pregnancy. Then PID, current PID. Past history of PID. Okay, PID, current past history of PID. फिर वजाइना से ब्लीडिंग. ओके, वजाइनल ब्लीडिंग, अनडायग्नोस्ड etiology. यूट्राइन malformation नहीं, cancers. ओके, यूट्राइन cancers. ओके, that is important. ओके, everybody. ऑल राइट. रिलेटिव कॉन्ट्राइंडिकेशन में क्या है? एनीमिया. ओके, मेनोरेजिया. ओके, मेनोरेजिया. प्रीवियस एक्टोपिक, past history of PID, previous ectopic pregnancy, unmotivated woman, unmotivated person, because they should feel for the thread every day. Okay, what is the most common side effect of IUD insertion? Most common side effect of IUD insertion क्या है, guys? Most common side effect, सबसे common side effect क्या है? Bleeding है. Therefore what you should do? You should immediately take out the IUCD. No reassurance. Put the woman on iron tablets. Okay, put the woman on iron tablets for like for like 2 to 3 months. Okay, and what is the second most common side effect? Pain. But remember, pain is most common cause of removal. Most common cause of removal. Most common cause of removal. ठीक है? Is it clear of IUD? ठीक है? All right. Going to the next question. Everybody look at these three images. You could be asked what are they? This is copper T 380A. Shelf life of 10 years. This is Nova T. Nova T is copper T 380AG. And this one with the blue color thread and this is multi-load. Okay, this is copper T 375. This has a shelf life of 5 years. Now please remember, 380A and 375 are freely available. Okay, they are freely available till level of subcenter. Till level of subcenter. Okay, copper T 380A and copper multi-load are freely available. But look at this one. These are hormonal containing IUDs. Okay, this is Mirena. कोई भी copper wire नहीं है इसमें. LNG 20. 52 मिलीग्राम लिवोनॉर्जेस्ट्रल होता है, 20 माइक्रोग्राम हर दिन रिलीव करता है. इसका शेल्फ लाइफ हैज नाउ increased to 7 years. This, as we all know, is Progesta cert. Okay, previous ectopic is relative contraindication. ठीक है, previous ectopic is relative contraindication. Okay, and Progesta cert, this has 65 microgram. The shelf life is 1 year. Okay, all right. ठीक है. Okay, let's go to the next question. Everybody quickly tell me which is this contraceptive. We've already done it. Let me finish, then I'll take up your doubts. Don't worry. ठीक है. Yeah, that is Progesta cert. Did we label it? Progesta cert. Okay, all right. Least failure rate Mirena का होता है, guys. Okay, least failure rate 0.2 to 0.3. Least failure rate out of all IUDs. Out of all IUDs. Okay, is of Mirena. And remember, these are third generation. Okay, this time in NEET PG they asked Lippes loop. Lippes loop inert हो गया है. ऐसा होता है Lippes loop. I will discuss in image based session. Lippes loop क्या है, guys? First generation है. Okay, and this is inert. Okay, and you also have a Grafenberg ring. Grafenberg ring. Grafenberg ring भी inert है, first generation. Copper containing a second generation. Very good. So what did you mark for this? इसका आंसर क्या लगाया? गुड. यू शेप मल्टी लोड. वेरी गुड. मल्टी लोड इज नथिंग बट कॉपर टी 375. ओके, नेक्स्ट क्वेश्चन. व्हाट इज द मोस्ट कॉमन कॉज ऑफ फेलियर ऑफ वेसेक्टोमी? Very good. Mistaken identification of vas. Vas का कितना centimeter has to be ligated? 1 centimeter has to be ligated. Okay. And what is the advice you will give post vasectomy? Okay. To use barrier method. Okay. Use barrier method. All right. Use barrier method for 3 months. Okay. Or 20 ejaculations free, or 20 ejaculations free. Please don't say 30, 20 ejaculations free. Okay. All right. Let's see one more question. Vasectomy is the most cost effective. Remember, vasectomy का least failure rate है. All right. But it is the least practiced, सबसे कम prevalence है, least failure rate. Which is the most common practiced contraception in India? It is tubectomy. Okay, most common contraception practiced in India, most common contraception method. Okay, most common contraception method जो इंडिया में है ना, वो tubectomy है. And vasectomy has least failure rate, but it is least practiced. Okay, it is least practiced. Okay, so what is the answer, everybody over here? Client should be married. Okay, has at least one child whose age is above 1 year. Clients can be between 18 to 60 years old. Clients or their spouses must not have undergone sterilization in the past. Now I can see you're getting very confused over here. Okay, so let me straight away take you to the criteria because we are running short of time. See, client's age should be 22-year-old male, 60 years maximum. One child, 1 year. Even for tubectomy, ठीक है, tubectomy में भी one child, ठीक है, one child कितना year? 1 year. Okay. All right. Clients of their spouses must not have undergone sterilization in the past. Must be in a sound state of mind. Okay. Ill psychiatry, अगर किसी को mentally ill है, then psychiatrist can certify it. Okay. So let us see over here. It was written 18 to 60. No, 22 to 60. मैरिड होना चाहिए. एवर मैरिड, डिवोर्स चलता है. मैरिड इज ऑल्सो अ क्राइटेरिया, बट एज में दिस इज नॉट द क्राइटेरिया. ओके. एंड वन चाइल्ड मोर देन 1 year old. ओके. Even do you need permission for this one? No. Vasectomy, tubectomy, किसी का भी permission नहीं चाहिए. And please remember one thing, sterilization कराने का सबसे अच्छा time क्या है? Interval sterilization is within 7 days. This is for tubectomy. Okay, within 7 days of menses. All right. Postpartum sterilization, this can come as an MCQ. मान लो somebody has delivered, then you should get it done between 24 hours to 7 days of delivery. All right. Even guys, IUCD का insertion best time क्या है? Best time is within menses. ओके, ड्यूरिंग मेंसेस के टाइम करना चाहिए. बट मोस्ट रिसेप्टिव टाइम क्या है? मोस्ट रिसेप्टिव जब शी विल अग्री, दैट इज पोस्टपार्टम. ओके, दैट इज पोस्टपार्टम. सो बेस्ट टाइम टू इंसर्ट एन IUCD इज ड्यूरिंग मेंसेस, बट मोस्ट रिसेप्टिव इज ड्यूरिंग पोस्टपार्टम. क्लियर? Okay. Last few question. What is this? I-pill emergency contraception. This is progesterone only pill. 1.5 milligram. Use within 72 hours. Okay. It should be used within 72 hours. And this is the most commonly used. Okay. But look at the next one, guys. Look at the next. These are the emergency contraceptions. Okay. These are emergency contraceptions. Please remember, पहले YASP method होता था, combined OCP. Ulipristal is progesterone receptor modulator. Mifepristone, अब इसका dose we are trying to reduce, guys. Okay, 200 milligram से now also shifting to 10 milligram. ठीक है. IUCD is best because can be inserted up to 5 days. Can be inserted up to how many days? Up to 5 days. ठीक है. Alright, up to 5 days. अगर you don't have emergency contraception, I-pill, progesterone only pill, levonorgestrel only pill, then we will go for, you can go for OCPs. Okay, alright. But best one is IUCD. क्यों? क्योंकि it could be inserted up to 5 days. Yes, I-pill is also known as easy pill, unwanted 72. ये सब उसका नाम है. चलो, just a few more questions remaining, guys. Let's quickly wrap that up. बताओ ये contraception क्या है? Just a second, okay? Okay, what is this contraception, everybody? What is this contraception? Anybody? What is this contraception, guys? एक second. Yeah, what is this? Very good. सबको पता है, this is a vaginal sponge. Now, vaginal sponge, everyone, has a V-shaped band. It's very difficult. It needs technique to insert. You have to push it, you have to insert in vagina, then push it to be placed over the cervix. Okay, and it has to be used 6 hours prior ejaculation, has to be left for 6 hours. Okay, left for 6 hours post ejaculation, otherwise will lead to toxic shock syndrome. Similarly for diaphragm कैसा होता है? ऐसा cap type. Okay, this is a cervical cap or diaphragm. Okay, diaphragm has a lower failure rate than vaginal sponge. Okay, in an educated female तुम diaphragm advise कर सकते हो, but vaginal sponge and diaphragms, no protection from STD, no protection from STD. ठीक है, प्लीज रिमेंबर. इसमें स्पर्मिसाइड कौन सा है? नॉन ऑक्सिनॉल 9. ओके, एंड इट इज अवेलेबल अंडर द ब्रांड नेम टुडे. इट इज अवेलेबल अंडर द ब्रांड नेम टुडे. एवरीबडी, किस नाम से अवेलेबल है? ब्रांड नेम टुडे. ओके, इट्स अवेलेबल अंडर द ब्रांड नेम टुडे. Just 1 second. Okay, it is available under the brand name today. Okay, so that you have to remember. Female condom कैसे identify करोगे? Female condom is identified by 2 rings here. Alright, female condom is identified by 2 rings. Okay, female condom is identified by 2 rings. ठीक है? Alright, female condom, male condom, never use it together. Now female condom can also be reused, vaginal sponge can also be reused, everybody. Just 1 second. Alright, ठीक है. यस, बोथ साइड्स रिंग है, एंड इसको किसने डिस्कवर किया था? MD हेसल. ओके, MD हेसल. ठीक है, नेवर यूज अ मेल एंड अ फीमेल कॉन्डम टुगेदर. चलो, लेट्स गो टू वन मोर क्वेश्चन. कॉन्ट्रासेप्शन मोस्ट सूटेबल फॉर अ न्यूली मैरिड कपल. क्या है आंसर? न्यूली मैरिड कपल. न्यूली मैरिड कपल के लिए कौन सा कॉन्ट्रासेप्शन है? OCP, कॉन्डम, स्टेरिलाइजेशन, IUDs. ऑप्शन सी मैंने बताया था ना, ग्राफेनबर्ग रिंग. इट्स द फर्स्ट जनरेशन IUD. इट इज इनर्ट. ऑलराइट, okay, don't have to worry about it, it's inert. Very good. OCPs, if it's a newly married couple, healthy couple. Okay, newly married healthy couple या healthy couple नहीं भी mentioned है OCP, because it has a lower failure rate. Okay, but if they are like, if the woman has any problem, she has some heart problem, then barrier method. Okay, contraception of choice for couples in long distance. Couples in long distance, what is it? Couples in long distance relationship, तब क्या है everybody? Please go for IUCDs. Okay, go for IUDs. Okay, IUCDs. Why? Because they have lower failure rate compared to barrier method. Lower failure rate. Okay, IUCDs, lower failure rate compared to barrier method. Okay, चलो, who is a target couple, guys? Who is a target couple? Quickly tell me. Target couple कौन होता है? पहले एक टर्म होता था गाइस, टारगेट कपल. ठीक है, पहले एक टर्म होता था टारगेट कपल. टारगेट कपल इज नो लॉन्गर यूज्ड. ओके, इज नो लॉन्गर यूज्ड. टारगेट कपल वाज अ टर्म व्हिच वाज डायरेक्टेड टू एलिजिबल कपल विद 2 और मोर देन 2 चिल्ड्रन. ठीक है, जिनके 2 या 2 से ज़्यादा बच्चे हो, उनको टारगेट कपल बोलते थे. बट नाउ वी से दैट anybody who's newly married is also needing a family planning method. Okay, so eligible couples who have 2 to 3 children were target couples. Now what is the term which is used, guys? Now the term used is eligible couple. Eligible couple matlab married couple. Okay, not currently married, any married couple, all right, in reproductive age group. Basically this is again an eligible couple. Okay, married couple in reproductive age group, whether somebody has a 2 child, whether somebody is newly married, 1 child, everybody needs family planning. टारगेट कपल में कपल के पास 2 या 2 से ज़्यादा बच्चे होने चाहिए थे. ठीक है, बट अब टारगेट कपल वर्ड ही नहीं यूज होता. चलो, बेस्ट मेजर टू इवैल्यूएट कॉन्ट्रासेप्टिव एफिकेसी. एनीबडी. कॉन्ट्रासेप्टिव एफिकेसी. कॉन्ट्रासेप्टिव एफिकेसी का मतलब क्या होता है? फेलियर रेट ऑफ कॉन्ट्रासेप्टिव्स. ओके, फेलियर रेट ऑफ कॉन्ट्रासेप्टिव्स. सो बेस्ट मेजर टू इवैल्यूएट कॉन्ट्रासेप्टिव एफिकेसी, व्हाट इज इट? Yes? Why aren't you answering? Can you see the question? Best measure to evaluate failure rate. Why can't I see your answers? 1 second. Okay, कोई लिख रहा है A, कोई लिख रहा है C. अरे बाप, what am I asking you? Best measure. That's how they will confuse you guys. Pearl index is what is used. Okay, what is used? We express in Pearl index. Best is life table analysis. Know this term. Best measure is life table analysis. Pearl index is most common used. Okay, most common used. Now see, what is Pearl index, guys? Pearl index होता है number of accidental pregnancies. Okay, number of accidental pregnancies divided by the total months of exposure, all right, multiplied by 1200. Okay, multiplied by 1200. Now see, suppose I have 100 couples. Okay, 100 couples who use a contraceptive X for 2 years. Okay, now 10 accidental pregnancies reported. 10 accidental pregnancy reported. 10 accidental pregnancies reported. Can you calculate, okay, the Pearl index? Now this is the last question. Okay, calculate the Pearl index. I'll come. Okay, so what did you calculate for this, everybody? Yeah, so what is the calculation over here, guys? Calculation क्या है over here? So we all know that best measure. Okay, very good. Pearl index मतलब क्या हो जाएगा? Accidental pregnancies 10 हैं. टोटल मंथ्स ऑफ एक्सपोजर 100 इंटू 1 ईयर में 12 मंथ्स, 2 years में 24 months into 1200. 1200 is the number of months in 100 years. So this is what? 5 per 100 women years. Got it? Everybody. इसीलिए टोटल कपल्स को मत भूलना. 100 into this one you have to use. ठीक है? Okay. Last क्वेश्चन फटाफट से बताओ. फॉर अ पॉपुलेशन ऑफ 10,000 व्हाट डज द सेक्स रेशियो ऑफ मोर देन 1000 मीन? नाउ आई जस्ट डू दिस फॉर यू गाइज. सेक्स रेशियो होता है नंबर ऑफ फीमेल्स पर 1000 नंबर ऑफ मेल्स. ओके, अब सेक्स रेशियो मोर देन 1000 कब आएगा? जब नंबर ऑफ फीमेल्स वुड बी मोर. यस, okay, but here the population is 10,000, so females have to be more than 5,000 or males have to be less than 5,000. Clear? Okay, see, ideally sex ratio 1 कब आएगा? नंबर मतलब 1000 कब होगा? जब फीमेल्स एंड मेल्स बराबर हैं. Okay, if it's a population of 10,000, then 5,000 female, 5,000 males. Now sex ratio is more than 1,000. That means number of females are more than number of males. So it is what? Number यहाँ पे 500 हो नहीं सकता because it is 10,000. So either females are more than 5,000 or the males are less than 5,000. Clear? Everybody? Okay. So that was it for today. I hope I have wrapped up everything. Do revise. Telegram quiz is at 8 p.m. guys. I will see you again tomorrow. I hope the speed was not too fast because these are revision sessions. कल का class है nutrition पे. Do share with your friends so that they can also attend all these sessions. You just have to come. You just have to sit. Please make a note. Sunday is a day for short PYTs and PYQs. Okay. So I'm going to see you all. Overall least failure rate I told you vasectomy. Tawfiq. ठीक है. Overall all contraceptives vasectomy. Okay. Thank you so much. Bye bye. Have a good day. Keep studying. Keep revising. बिल्कुल give up मत करना. It's just a matter of time now. Make the full use of it. Okay. Don't get caught up in any other thing. ठीक है. So bye bye. Thank you so much.